Hi, everybody. Hi, everybody. We're panel number one. Thank you to the Tufts School for inviting all of us to be here. I know we're all really honored to be on this panel, but I'm going to jump right into it because I know we have a wonderful long day of programming. You all have dedicated your careers to educating future healthcare professionals. You teach the future nurses, doctors, dietitians, who are really at the front lines of medicine in this country, the most important interface for the patient population. So why do you think nutrition isn't yet part of the curriculum universally in medical schools and nutrition schools, nursing schools, excuse me, even now in 2023, when with all that we know about how food is medicine or food is health, as Devries just said, you can start first, Steve.
Sure. Well, I think it's the culture of medical education. It really emphasizes the role of acute care, because just think, these physicians are being trained generally in hospital settings, and it emphasizes the role of pharmaceuticals over other treatments. And if you ask medical educators why they're not spending more time on nutrition, they say, we don't have the time. But think about this, and the data is really clear on this point, that if you look at the top risk factors responsible for death in the United States, 17 top risk factors examined, number one is poor quality diet. So let me ask you, if nutrition in a meaningful way doesn't make the cut, why not? What could be more important?
I think that's a perfect response to this, actually. Our medical system is, of course, very treatment focused, and I come from things with a bit of a public health lens, and so we think about prevention and intervention all of the time. So if we need to kind of turn the conversation to nutrition as this preventive or vehicle for intervention, and that would certainly make an impact there. I have some hypotheses about this. I'm not sure if any of them are correct, but nutrition is a relatively young science compared to other fields. First vitamin was isolated only in the 1900s, and so that's not terribly long ago. That's just a century ago. It's also very personal and very cultural, and so I think there's a little bit of hesitation to really get in the weeds with something that is so inherent to who we are as people.
Kim?
Yes, I echo all that Stephen and Ashley have said. I think in addition to the board exams for medical schools and nursing schools, they don't prioritize nutrition. The case studies don't include nutrition. And so I think, trying to change the exams to be more current with what we are seeing in the healthcare field is necessary as well.
I come from a different angle. So the way I look, I do agree with everybody saying. I think it's all the medical society understand is nutrition can empower them to provide more comprehensive care. And nutrition is not only a diet guidance. Nutrition involves in many things, the food insecurity, cultural competency, and other environment conditions. So I think if we realize we all agree with that, the teamwork to include the nutrition is very important.
Okay, so we've identified that. But so Steve, in your experience, what is the current state of nutrition education among health professionals, and what progress has been made, and where do you see this going, and how could it go further?
Well, the current state is kind of poor.
Yeah.
And where it is in medical school, on average, about 19 hours spread out over 4 years. A lot of that is related to biochemistry, which is a very important topic, but it's not exactly, in typical way, directly relevant to patient care. And the lack of prioritization on nutrition has not been lost to the medical students, because get this, in a survey of incoming medical students, asking them about how relevant they felt the role of nutrition and its connection to health was, those incoming students felt that nutrition was more important than outgoing medical students surveyed did. So that tells you a lot about where things stand. And unfortunately, in graduate medical education, sometimes things even go downhill from there. Because for many specialties, key ones like internal medicine, pediatrics, cardiology, my field, there are 0 nutrition competencies currently set. 0. So with all of that, now there are some really exciting, innovative programs, a lot with culinary medicine going on, and they need to be enhanced because many of them are now electives. Many of them are supported by philanthropy, and there's nothing wrong with that, but it's not exactly a sustaining model in every case. But with that, I believe there's a lot of room for optimism, and I believe this last year has been the most optimistic of all. Why? It began just over a year ago. The U.S. House of Representatives had adopted a resolution that was introduced by Congressman McGovern and Burgess. This was a bipartisan support. I mean, you can't get bipartisan support for like the benefits of motherhood. I don't think that would cut it. But this was for nutrition education, how important it was for doctors. Then came in September the White House Nutrition Conference that is part of the strategy. Nutrition education for health professionals was highlighted, very importantly. And for that, we can, to a large extent, thank Kat Okar. I don't know if she's in the room, but she has done a lot to move this forward, and I think deserves a big round of applause for that. Awesome. And then, as Dari had referred to, the ACGME, the accreditation group for physicians, had launched their first ever nutrition education summit just 3 months ago in Chicago. And so we're really hopeful that there are going to be some great changes there. And I have to say that this area has affected me personally. I had a very busy preventive cardiology practice with a 9-month wait list, and actually felt like I could make a bigger impact in that area by becoming director of the nonprofit I direct, the Gaples Institute. And I'm very proud to say that the Gaples Institute nutrition course that's been developed is now required in 7 medical schools. It's required, not elective, and 97% of the students who take the course say it will change their practice. And can I tell you one of the most rewarding things and what really justified this career transition is the fact that every single day I get comments from medical students saying for the first time they're able to actually help their patients in ways they couldn't do before, ways they wanted to but didn't have the training. And the nutrition training actually helps their own self-care, something which really requires a lot of attention as the burnout rate among physicians is really high. So I wanted to actually think about this, make an offer to all of you, and this is a real offer. If you're ever having a bad day, write to me. Seriously, email me, and I will send you one of the comments that I receive. I'll take the name off, so you won't know who it's from, but really, it makes it just is so gratifying to get these comments. You'll love to get them too.
Well, I hope you all have his email. That'll be important to hold on to. Kim, so you teach here at Tufts, and this link between nutrition and health has been important in your teaching here at Tufts for a really long time and been underscored for students. It's been a priority. So can you explain why this approach is important here as opposed to maybe other places, and what does that look like in practice?
Thank you. I feel really fortunate to be here, faculty at Tufts. I teach the nutrition course for our medical students. And this medical course, not that I've been teaching it for a few years, but it's been embedded in the medical school curriculum for decades, which is really, I think, at the forefront. But I think us being here in the health sciences campus with the School of Nutrition, the School of Medicine, the School of Dental Medicine, nutrition has really been embedded into the curriculum for all of those programs. So all of our healthcare professional students are receiving that information. Our physician assistants students are also getting a nutrition course in their curriculum. And I just launched a community health worker training program where nutrition is also embedded in that curriculum. So I think, we're so poised to be able to do that here and to be the leaders in this. I think that, it's been really great to be a part of it. And I think just dovetailing off of what Stephen was mentioning, it's not just talking about the nutrients and the biochemistry. It's important for our medical students or healthcare professionals, but it's also thinking about the food as medicine approach and knowing that this impacts all of our patients. And what I say to my medical students is, this is not necessarily going to be on your board exam, so I know that you may not sort of like be at the forefront because you're studying for that exam right now, but I guarantee you, nutrition, diet, all of this is going to come up with at least a majority of your patients. This is at the heart of what they care about. This is what they're dealing with on a day-to-day. So having that conversation is going to show to them that you care about them, and it's going to continue to build that rapport and trust. And I think that that's true, right?
Yeah. And Shirley, so as a dietitian, can you talk about the importance and effectiveness of malnutrition screenings, especially for older Americans, which has been your expertise, and doing that as an early intervention before someone has diagnosed?
Malnutrition with elderly actually is a very serious issue. In the community, sometimes you wouldn't even know this person is malnutrition. And it can be undernutrition, could be overnutrition, could be obesity, or be frail. The older people, they deal with a lot of issues, the loneliness, isolation, and food insecurity. It's a lot of issues. So the nutrition screening in the early stage in the community and in the hospital can help the recovery of disease, but also the prevention, that can help them regain the quality life. I think that's one thing we all agree, is some simple intervention can change a person's life. So that it go back again. You have to recognize the importance of nutrition as a primary determinator for health.
Well, so this leads right into my next question to Ashley about nurses, who generally are going to be the first people on the front lines with a patient. So what role can those nurses play in delivering healthcare information, nutrition-related information during a healthcare screening to their patients? And I know that's important in your teaching at BC, but are there other places that are working on that?
Sure, that's a great question. So nursing is the largest healthcare profession in the United States. There are over 4 million registered nurses. So if we're talking about sheer volume, sheer numbers, that is a sizable impact if every single one of those nurses had nutrition information that they could impart to their patients. But getting away from the numbers, I think generally nurses spend a bit more time with the patients than physicians get to. And so they get to know a little bit more about the patient history, the patient context. And so we would hope that they could provide accurate nutrition information that's relevant to the patient for their history, for their context. If it's something that rises to the level of some sort of nutrition intervention that's needed, something that is feasible for those patients, maybe tackling issues related to food access, food insecurity in some of those conversations and screenings that happen in primary care facilities. And in terms of places where nutrition education for nurses is really doing well, I want to highlight UPenn. They have an excellent series through their nursing school of majors and minors, again, embedded within the nursing school, and also graduate certificates for graduate nurses, nurse practitioners, et cetera. And so they've set up a really nice template for, I think, a lot of nursing schools to potentially follow and see where it leads.
Oh, that's great. All right, Steve, so what are the opportunities for interprofessional work and an approach to nutrition education and patient care? So how do you maybe get a doctor, a nurse, and a nutritionist together in that realm?
Yeah, that's a really great question, because you won't find any bigger advocate for the role of physicians getting involved with the nutrition, but it's very clear. Physicians can't, won't, shouldn't do it all. This is a team approach that is absolutely needed. But the whole idea of nutrition education for physicians is to get them up to speed so they can be meaningful members of the team, along with the dietitians, the nurses, the health coaches, the chefs, and everyone else. So, what's really interesting is that, I wanted to study this question and did a study that looked at physicians who got just a little bit extra nutrition education after their training, and it showed that those physicians were almost twice as likely to make referrals to nutrition and diet professionals. So the idea is we've got to get everyone up to speed so that everyone can make the maximal contribution, because doing anything, giving medications is not a habit that people generally will continue with, even that, but lifestyle changes can be challenging, and it takes the team that can make things happen. And with an interprofessional approach, the future for this area of food as medicine is awesome.
Okay, so Ashley, how do you operationalize that kind of nutrition education in nursing schools? And how do those courses fit into the existing curriculum? Do they have to replace something else? There's not all that much time in one's day. And are there, well, you already mentioned the other nursing schools, so well, yeah.
Yeah, this is my big question too, frankly. I think we're all very happily, just with medical schools, nursing schools, they have competencies that are necessary to be taught for accreditation purposes, and we want that, right? We want everybody who comes out with a nursing degree or a medical degree to say, yes, they are insured to have these competencies, right? But nutrition, although in nursing programs, it's taught as, part of a patient's diagnosis or part of a patient's treatment plan or recovery, it's not the core focus. And so there isn't a specific set of guidelines for how nutrition needs to be taught in nursing schools and in nursing programs. As I mentioned, some folks or some programs, they offer nutrition electives, they offer nutrition majors and minors. Some schools take the approach of threading nutrition throughout other courses like pharmacology or health assessment. So it's always kind of there and embedded into other courses that have existed for a very long time. Is there a right way to go about doing this? I'm not entirely sure. I think we need more data. As the epidemiologist, I'm always going to say that, though. We need more data. What I will say, just kind of piggybacking off of things other folks have said, is there's certainly a recognition among our students that nutrition is imperative and important and cannot be divorced from good health. And so our lovely dean at BC School of Nursing, Kate Gregory, she was actually talking with a student at the end of the semester and asked, how did classes go? And the student brought up her pharmacology course, and usually pharm comes with a big, oh, that's one of the hardest courses we have, of course. But the student just made this very innocent observation and said, we had 12 classes on traditional pharmacology, 3 in nutrition, and I think that if we'd had 12 classes in nutrition, we'd only need 3 in pharmacology. And
Brilliant.
And it's, again, such an innocent observation, but really astute and really profound. So there is recognition there from students. And again, I don't think that they're divorcing the nutrition and health concepts from one another, especially as conversations about social determinants of health are really starting to become more prominent in the clinical space.
Okay, so Shirley, then, what does it take to make sure that nutrition becomes just as important as any other subject in training future doctors and nurses?
Good question. I see a couple areas. One is the dietitians, the nutrition experts should be sitting in the table to prepare the curriculum. I think that is the professional we are in, and that is very important. Who is teaching it? Also, I think maybe the dietitian, the nutrition experts to teach it. Another thing I see is adequate funding on some important initiative. Food is medicine, or nutrition screening in the community, or in the hospital setting. Those things will show more prevalence on the nutrition inadequacy. That will actually move the allocation to this direction. The last one I see is we need more campaign. Besides the nutrition experts, the dietitians, we need other healthcare professional. I would like to say is like Dean Musafarian. He is a cardiologist, I think I'm right, but his leadership and his advocacy in this field and made a significant difference, and that's where we are here today, have this conference. And seeing, I think I saw Dave Water earlier, is the rock is there. We are together move this rock. So I see it's a joint effort and from different angle.
That's great. That's great. And Kim, this is slightly different, but as patients, people in general are bombarded every day with both positive information and disinformation online. What do you think that means for the importance of nutrition education for trainees as they're going to approach their work when they leave school and go into the field?
Yeah, great question. So, with social media, the TikToking and internet, all of that access, people have information at their fingertips. It's not always accurate information, and nutrition is also, part of that misinformation. So training our healthcare professionals, our physicians, our nurses, to work together with dietitians and other healthcare professionals to be able to be on the front lines to address what they're hearing in social media, and to dispel some of these myths is really important. And so I think that they'll have their work cut out and very necessary.
Yeah, I mean, I am a middle-aged woman with an Instagram account, and the number of things that are bombarded at me every day, and I think I know better, sort of, but it's hard. It's hard to know what's right. Okay, so in the final few minutes that we have left, I wanted to just ask you all to reflect on where you hope to see nutrition education in the next 5 to 10 years, and we'll start with you, Steve.
Sure. I can tell you by way of a story. I teach a class on physicians as change agents at the Harvard School of Public Health, and we have a final assignment for a nutrition-focused system change that the students want to propose. And this one is what crystallizes my vision of the future. This was an ER doc who said, patients come to the emergency room most often with acute manifestations of chronic disease. And if we could make urgent referrals to dietitians from the emergency room, wouldn't that prevent these patients from needing to come back? And I thought, wow, to look at the future in such a creative and big picture way, that's the kind of future that I envision, and that's the kind of future that I think we're all going to see.
Wow.
I'll echo Steve's thoughts on that. I think another thing that we talk about a lot is wanting our patient care to be thoughtful and deliberate and person-centered. And I think to really provide the best patient care, nutrition has to be part of that conversation. And so thinking about some of those immediate referrals, I think makes a lot of sense. Also, just having your health professionals know some of the resources that are available so that they can tell patients about, I'm thinking about, local organizations or food banks that they, might want to consider. Or if it's something like a patient comes in, screens for food insecurity, and they say, hey, we have somebody who can help you fill out a SNAP or a WIC application. That goes a long way. So I'm hopeful that in the future, healthcare professionals just have a better idea of the resources that abound and can pass that along to patients, in addition to the nutrition knowledge and information that they hopefully will have through curriculum.
Great. Echo all of those things, and just, again, this interdisciplinary nature that's important so that we can provide, frontline information from physicians and nurses, really detailed menu planning, et cetera, with dietitians, helping to find food resources in the community, also embedded with social workers, et cetera. But again, to emphasize that need to ensure that we're shifting that conversation to prevention as well. And so that if we can embed this in the curriculum and start to have our healthcare professionals even have this conversation about nutrition with the younger generation, so with pediatrics, or even just from day one, so that, healthy nutrition is sort of embedded from earlier on in life, I think is important.
And Shirley, you get the last word.
I got last word. I think I agree with everybody, the interdisciplinary approach and the interprofessional education, and I think we can bridge this knowledge gap between our professionals. And I definitely want to say, take advantage of the dietitian. They are fully trained, refer to them, and we work together as a team.
Thank you all. Thank you.
Thank you so much to all of the panelists. What a great conversation. I think it's clear that empowering health professionals will lead to empowered patients when we're talking about nutrition, and that's really what's so exciting.